We welcome Dr. Bishop, sports medicine surgeon at Rothman Orthopaedics. To learn more about their New York offices, go to rothmanny.com. Dr. Bishop, Evan Roberts, how are you?
Hey, Evan. Thanks for having me.
Thank you very much for coming on. So I've got a couple of things. When you have a hamstring issue, and like the Nets haven't revealed like what type of strain James Harden had, I understand that. But is there a risk that are you riskier to re-injure yourself when playing sooner than maybe the rest indicated when you're playing on an injured hamstring?
Definitely. I mean, the main risk of going back too early with hamstring injury is that you can re-injure it again or potentially have a more significant injury to the hamstring. So the main risk factor of re-injuring your hamstring is a prior history of having a hamstring injury. And James Harden, dealt with that for a lot of the season this year. So he's obviously not at 100% trying to play through it right now, but he does have a risk of injuring it more significantly and really injuring something else if you are kind of compensating and not performing the way you want to be and moving the way you want to be. You potentially could hurt something else.
We think back to Durant a couple of years ago where he came back too early on a calf issue and then tore his Achilles, and obviously that was catastrophic. Is there anything catastrophic? Not just, hey, you're injured his hamstring, he's out for the playoffs, which would be bad, but something even more serious that could affect him long term that's at risk because he's playing right now?
Yeah, that's a great question. That was very unfortunate with KD's injury in the playoffs with tearing his Achilles with that. This isn't quite the same thing. The chances of him actually fully tearing his tendon off the bone with the hamstring would be incredibly low because this is more of a kind of a muscle type injury rather than the tendon attachment to the bone. So, he could certainly tear his hamstring worse in the muscle belly, but which would kind of just extend his recovery time. But I would not expect this to become a surgical issue in the future if he does make it worse.
All right. That's good to know. Now, I feel bad even asking this because if the Nets lose tonight, it's completely irrelevant, but I'll ask it anyway just so I know about it in the back of my mind. How realistically, when you sprain your ankle the way Kyrie Irving did, what's a realistic timeline for him to return and play basketball again?
So, I don't know based on the MRI if they said whether or not it was considered necessarily a high ankle versus a low ankle sprain. But it seems to me like this is probably more just a significant lower ankle sprain based on looking at the injury and kind of how they're describing it. If we actually have data on this in the NBA, and people that have just normal low ankle sprains, this means an average of 2 games and return to playing 8 games. So for normal low ankle sprains with the NBA players, that's what we've found they've done in the past. They're usually back in 8 games. The higher ankle sprains, as we know, LeBron had that this season. Yeah. And was out for quite a long time. It's actually a lot longer. It's an average of 5 games you miss and up to 24 days. So, hopefully this is more the lower ankle sprain, and he's kind of looking towards 8 games or 8 days and 2 games. So this is now going on 3 games missed. But my hope would be, if they win tonight, he'd be ready either by game 1 or game 2 of next week.
Oh, that's good. I don't want to think too much about it, but that's very good. Hey, one last thing, Doc, while we have you on the phone. Is a flexor tendon injury related to a shoulder injury, which could be related to a side injury? And the only reason I ask that is those are 3 separate injuries Jacob deGrom has had, and he has said none of it's related. And maybe it isn't. I don't know. You know more than I do. It's just weird that he keeps having injuries. So would a flexor tendon injury be related to a shoulder injury, and would a side injury be, connected to any of those 2 injuries?
Yeah, it sounds like there's probably something off in his kinetic chain, with pitching. Pitching is not necessarily just using your shoulder or your elbow. It's a whole body motion, obviously. So if there's something off in the way he's throwing, he certainly could be overcompensating with his side versus his shoulder versus his, flexor tendons at the elbow. So, I would expect there might be something biomechanically a little bit off that could be contributing to these injuries. So it's definitely possible that they could be related.
Interesting. All right, Doc, I really appreciate it. You gave me a lot of information, all of us listening, so great stuff. Really appreciate you coming on. Thank you, Doc.
Excellent. You're welcome. Have a good one.
You too. That's Dr. Bishop from Rothman Orthopaedics. And you can learn about their New York offices by going to rothmanny.com. Zoo, man, you're good. I got to tell you. Because of all the injuries that we're dealing with and that we watch.